Now we'll try to address another complication that could come up in rheumatic heart disease, and this is what is known as myocardial infarction in rheumatic heart disease. So the myocardial infarction in rheumatic heart disease is like this. Is rare, but if it occurs, it's significant. Okay, so it often results from the coronary artery involvement. So if there's so much inflammation that it actually got to the level of the coronary artery, the coronary artery could become narrowed up. Now blood flow is not adequate again. Do you understand? So rheumatic heart disease is a long-term consequence of rheumatic fever. Now, while primary causes valve damage, sometimes it can involve vessels, okay, where there's inflammatory damage and the vessel is getting narrowed up. So later on, you are having blood clots here and there. Do you understand? Coronary vasospasm or microvascular dysfunction. Now, risk factors and mechanism is autoimmune inflammation. So patients with autoimmune rheumatic disease, so the ones that the body's immune system is also following up to attack the body, are the ones that are likely to develop this. Okay, if they have underlying hypertension, if they have underlying diabetes, if they have underlying hyperlipidemia, okay, then also valve related complications. So such a patient will be having so much chest pain, difficulties in breathing, palpitations, then they can also even be fainting, or they'll be so weak. Okay, so you diagnose that by ECGs, cardiac markers, echocardiography, coronary angiography. Okay, so treatments, you are mainly trying to handle the inflammation and the abnormal blood clot that should come in. You are trying to give drugs that will prevent abnormal blood clotting.